Welcome to the latest edition of Public Health Updates, covering breakthroughs in the past 2 weeks, brought to you by Lucid Quest. We begin with new data on tezepelumab for severe asthma. In a study of 298 adults across 11 countries, clinicians tapered patients' oral steroids while they received monthly tezepelumab. About half of the participants were able to discontinue oral steroids entirely, and around 40% reached low-dose levels. Although full endpoints were not disclosed, these steroid-sparing results may influence future prescribing decisions and payer assessments, especially in patients facing long-term steroid toxicity. Next, researchers at the Icahn School of Medicine at Mount Sinai report progress on an mRNA-encoded peptibody therapy for multi-drug-resistant pneumonia. In mouse models and human lung tissue, repeated dosing via anti-inflammatory lipid nanoparticles slowed bacterial growth and reduced lung burden compared with approved antibiotics. These results remain preclinical, but the modularity of the mRNA platform suggests potential for rapid development of new anti-infective strategies. A large chemical screen from a Cambridge-led consortium evaluated 1,076 industrial and agricultural pollutants on 22 gut bacterial species. The analysis identified 168 chemicals that inhibited bacterial growth. Some showed resistance mechanisms overlapping those seen with antibiotics. While the work is in vitro, it underscores how routine environmental exposures may influence the human microbiome and shape antimicrobial resistance pathways. MIT's BOLTS-GEN model marks a step forward in open-source protein binder design. Validated on 26 targets across 8 independent wet labs, the system produced nanomolar affinity binders for roughly 2/3 of 9 hard targets. By unifying structure prediction and binder generation in one framework, BOLTS-GEN highlights the rapidly expanding role of AI in therapeutic discovery and the potential for wider access to advanced protein engineering tools. A longitudinal study published in Science Translational Medicine followed individuals with ACPA autoantibodies for up to 7 years. Researchers observed systemic immune dysregulation and epigenetic changes across multiple immune cell types well before any rheumatoid arthritis symptoms emerged. Although the exact clinical endpoints were not specified, the findings could open doors for earlier risk stratification and preventive approaches. In adolescent health, new results from the ABCD study analyzed data from over 10,000 US participants. Children who owned a smartphone by age 12 had higher rates of depression, insufficient sleep, and obesity 1 year later. The associations persisted even after adjusting for other digital device access, but remain observational and not causal. Still, the findings contribute to ongoing debates about early digital exposure. A Yale-led metabolic oncology study examined how exercise slows tumor growth in mouse models of breast cancer and melanoma. Voluntary aerobic exercise redirected glucose toward muscle, depriving tumors of fuel and reducing growth rates. The mechanism involved downregulation of mTOR signaling. Though early and limited to animals, the work strengthens the rationale for incorporating structured physical activity into cancer care pathways. Finally, a review of evidence on diet soft drinks synthesized observational studies and regulatory assessments. Associations between artificially sweetened beverages and metabolic disease remain suggestive rather than causal. Aspartame continues to be classified as possibly carcinogenic by IARC, but this designation applies to high exposures and does not establish risk at typical consumption levels. The findings highlight the need to distinguish correlation from causation when interpreting nutrition research. Stay ahead in public health research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com.